doctors. Good afternoon. Welcome back to our classes. Dr. Swarna Balaji, online Ayurvedic classes. In today's topic, we are going to deal with disc prolapse. This is a topic which will be noticed in the diseases of spine, which is seen in the Shalyatantra, in the fine ear. So, what you have to mention if it is asked disc prolapse means, you have to draw two diagrams. As I have mentioned, N and P. N is the normal one and P is the prolapsed one. And what are the topics which you have to cover if it is asked means? You have to write causes, you have to mention the diagram, you have to write the clinical features and investigations, finally the treatment. First of all, you have to write the definition. What is the definition? Profusion of the extrusion of nucleus pulposus through a weak point of annulus fibrosus is a disc prolapse. This definition is completely filled with the terms. So you have to mention it clearly. The profusion of extrusion of nucleus pulposus. Firstly, you have to know this diagram. First one is disc, second one is annulus fibrosus, third one is nucleus pulposus, fourth one is nerves, fifth one is spinal cord, and the last one is vertebrae. That edge part which is seen as U will be there, no? That thing is the vertebrae. Okay, first thing is the second part, that is annulus pulposus, and here the disc prolapse consists of three parts. What are they? Nucleus pulposus, annuli fibrosus, and the cartilage end plate. Okay, the profusion of the extrusion of nucleus pulposus, the third part which I have mentioned, in that particular ring you can notice that third part, the extrusion of that nucleus pulposus through a weak point, that weak point of annulus fibrosus, which is the second part. You can note that in your diagrammatic representation. Okay, this is considered as disc prolapse. Next, the prolapse of the nucleus pulposus through a weak point of annulus fibrosus. This is the simplest way to answer this definition. Okay, next. Move on to causes. What are the causes? It may be congenital, that is through spina bifida, and it may be through traumatic, that is any ruptured disc or compression. It may cause due to inflammatory, that is ARIA factor, and due to any ankylosing spondylitis. If you want to know complete details regarding this ankylosing spondylitis means, you can refer our Shalyatantra playlist. I'll give you the video link in the description box. This previous video is that ankylosing spondylitis. Next, it may also cause due to any degenerative changes like degenerative diseases and disc and osteoarthritis. And the final thing is, it may be caused due to any neoplastic changes. What are the causes? Congenital, traumatic, inflammatory, and degenerative. Next, what are the stages? Stage of degeneration, stage of protrusion but contact with that intervertebral disc. Third stage is stage of protrusion outside that intervertebral disc. Fourth one is stage of fibrosis. Okay, these were the four stages. Stage of degeneration, stage of protrusion but contact with intervertebral disc, and third one is stage of protrusion outside the intervertebral disc, and the fourth stage is stage of fibrosis. Okay, next, clinical features. What are the clinical features? You will notice pain, neurological symptoms like numbness and paresthesia, nerve root pain is noticed in the case of sciatica, and tenderness will be noticed. These were the clinical features. Investigations is SLRT, X-ray, AP lateral, MRI and CT. These were the investigations procedures which you have to advise regarding this complaint of this disc prolapse. While coming to treatment point, you have to concentrate on conservative treatment, physiotherapy and finally surgery. What is the conservative treatment? Advise rest, use of a hard bed for the sleep. This is a conservative treatment. Next, you have to advise analgesics for subsiding the pain like aspirin and ibuprofen. Next, postural training. You have to advise the patient regarding the posture. You have to sit in this manner. you have to train the patient. Use of a belt and collar. These are coming conservative treatment. Next, you have to advise physiotherapy and surgery. Regarding that surgery, laminectomy, rhizotomy, discolysis were the most seen surgeries regarding this disc prolapse. This completes the complete details regarding the disc prolapse. If it is asked in the examination point of view means, at that time first you have to write your definition and you have to concise the definition in an easy manner. That is protrusion of the nucleus pulposus through a weak point of annulus fibrosus. Next, you have to draw this diagram to support your definition. Okay, you have to mention that particular annulus fibrosus and nucleus pulposus in a clear way. Next, you have to write the stages, 4 stages and their names. Later on, clinical features. Finally, investigations and treatment. In the treatment, you have to concentrate both on conservative and surgical procedures. This completes the complete answer, which will give a good presentation in your examination, so that you have a best scope to attain a good marks. What you have to do is, if this video is useful to you, like our video, subscribe to our channel, share this video to your friends and juniors, so that you will get best of our lectures. Thank you. Subscribe, like and stay tuned to our channel for more and more updates.